If you love the water, my kids do, you may be familiar with what is called swimmer's ear, and it can be painful, certainly. And here to tell us about what causes it, how you can treat it, how you can prevent it, is Dr. JJ.
I just hurt thinking about this.
Yeah, it does. It hurts.
What is it? Far more. Well, it's far more painful than middle ear infections, believe it or not. And what swimmer's ear is, and Dave Lowe's been nice enough to give me a beautiful drawing here. It's an infection, either bacterial or fungal, of the outer ear canal. So that's where we put cotton swabs in to clean our ears. Yeah. So when moisture gets in there, or if sweat accumulates, or if you have conditions like eczema or seborrhea, you get swelling and inflammation of this area, and it's extremely painful, and very commonly occurs in the summer when all of us are waterlogged, but especially like in oceans and lakes where the water might be a little polluted, so you're more likely to have a little overgrowth of bacteria there.
So what are the symptoms of it? Is it an earache?
Yeah, how is it different than an earache?
Okay, so first of all, there is pain involved, no doubt about it. But actually, it's different than middle ear pain. If you've got swimmer's ear, if you manipulate the ear like this or press on what's called the tragus here, say a kid is laying down in bed at night and going, oh, it hurts when I press. That's usually an indication that the canal is inflamed. But the first sensation you might get is one of almost like temporary deafness, like sounds muddled. You might have that sensation of like moisture in your ear.
Yeah, what is it though when the water does come out though? I always thought when you had swimmer's ear it was because water was in your ear, but
it's true. Well, water will enter the ear or perspiration can accumulate here. Now here's the eardrum, and this is like a solid door. So nothing comes from the middle ear here. This is a cul-de-sac, and fluid should just come right back out. But say your head is upright all day after swimming and you don't have a chance to kind of drip it out, you know, like our parents used to do or we used to do, then that water can just stay stagnant, and especially if you have like chlorinated water, it breaks down the protective lubricant barrier that's in the ear canal here and just makes that skin that much more delicate and susceptible to overgrowth from bacteria, to irritation from the chlorine, or from fungal infection too.
Well, how can we protect our kids from getting it in the first place? Can you?
Yes, you can. Yes, you can. There are many home remedies that are just as effective as things that you can buy in the store. So first of all, keeping the ears dry is a good idea. So putting earplugs in is good, but some kids just don't deal with that sensation very well, but you can get little wax earplugs at the store and they're moldable and you can put those in. Second thing is that after swimming, you can try to dry the ear, and the best way to do it is either with a blow dryer on cold for a few seconds, or you can have your child lay down, and if you have an active child, forget about that. But the easiest thing is to either make a solution of half white vinegar and water or half white vinegar and rubbing alcohol. And after your kid swims, or yourself, put a couple drops in, let it sit for 30 seconds, have them sing a song, and then just shake it out. And that will dehydrate the water in the ear, make the pH different so that the bacteria have less of a chance of growing. So that's one of the best strategies. Just keep a bottle of it poolside. You can put it in a little dropper bottle, so if you're traveling, you can bring it on the plane.
You wouldn't want to use a cotton swab to get the water?
No, because cotton swabs can actually be the enemy too, because they can remove some of that lubricant barrier that's in there that protects your ear canal. So we say that the largest thing you should put in your ear is your elbow, because the cotton swabs can actually denude this area or cause local abrasion or even a little cut.
Sure.
When should we call the doctor?
I think if you have pain that is so severe that your kid is up at night and there's no relief in sight, even with oral pain medicine, if there's fever, if there's a lot of drainage from the ear, which sometimes can happen even just from this, and your child is, or if you start to see spreading redness around the ear, or if there's pain that actually goes down the neck or the face, that means that this infection is deep, and especially if you have a child or an adult with diabetes or other immune compromise. These infections, although they sound benign, can actually go deep into the bony structures and everything, and they can become quite severe in rare circumstances.
How soon will you see this after swimming?
Sometimes
will it happen
hours.
Just a couple
Sometimes
hours after?
I remember with my own son, I mean, he would come home from the beach, sand in there all day, breaking down all the barriers, and he would be in excruciating pain by that night, and it wasn't a middle ear infection. It had to be a swimmer's ear, So I think when in doubt, check with your healthcare provider. Try not to put anything in the ear. Give your child oral pain relief until a doctor can see you, and then we have plenty of tools to treat it in the office.
And then call your mommy.
And call your mommy.
No, it's easier
call your
to
mommy,
call you.